Diabetes is a disease that limits the ability of the pancreas to produce insulin. More specifically, type 1 diabetes is an autoimmune disease that causes the body's immune system to attack and destroy the cells of the pancreas. As a result, little to no insulin can be produced. Normally, when you eat, your body absorbs glucose from the food, which causes your blood sugar levels to rise. This triggers the release of insulin, which allows glucose to enter the cell. However, with type 1 diabetes, no insulin is produced. Because of this, the blood glucose levels remain the same. Although there is no cure for diabetes, there are many ways to manage the disease and stay healthy.
Once you have been diagnosed with diabetes, nothing about what you can eat really changes. The way to go is to try to fit diabetics and insulin around the same healthy, balanced diet that is recommended for everyone, with lots of fruit and vegetables and food from all food groups. It is also a good idea to include some carbs with your meals. Some things to avoid would be sugary drinks and fruit juices. Instead, try to go more towards water, sugar-free drinks, diet soft drinks, tea, and coffee. Also avoid labels that say diabetic or suitable for diabetics.
Blood sugar monitoring is a way to keep track of your glucose levels. It can help you make important decisions throughout your day. Your blood sugar levels can also tell you many different things. If it's too high, then you need insulin, or if it's too low, then you need to take in glucose. In addition, it can tell you if you're staying healthy or if you need exercise. Maintaining your glucose levels can reduce the risk of nausea, weariness, or even fainting.
Exercise is very good for type 1 diabetics. It makes it easier to control your blood glucose levels, and exercise increases your insulin sensitivity, meaning your body doesn't need so much insulin to process carbohydrates. Exercise can also help avoid long-term complications, especially heart problems. Because there are three main kinds of exercise: aerobic, strength training, and flexibility, it would be wise to balance all three out. Some exercises you could do for aerobic exercise would be walking, jogging, running, tennis, basketball, swimming, and biking. Aim for at least 30 minutes of this kind of exercise most days of the week. Strength training gives you lean, efficient muscles, and it also helps you maintain strong, healthy bones. For strength, you can lift weights for about 20 to 30 minutes, 2 or 3 times a week to get the full benefits of strength training. Flexibility training will help you improve how well your muscles and joints work. A recommendation would be stretching before and after exercise, for this reduces muscle soreness and relaxes your muscles.
A dietitian is a professional that works to counsel others about food choice and nutrition. They help to answer questions or resolve issues involving these subjects. Oftentimes, they'll need to assess their patient's current diet and offer change. If needed, they will develop meal plans for a patient that make sure they receive proper nutrition and maintain a regular blood sugar level. An endocrinologist is a type of physician that studies the endocrine system and hormones. They treat people that suffer from hormonal imbalances in their body. They run tests to see what the potential problems with the patient could be and offer treatments as well. Since type 1 diabetes causes the immune system to attack the pancreas, the hormone insulin cannot be produced. An endocrinologist can offer treatments for the lack of insulin, such as the use of an insulin pump, a healthy diet, and maintaining exercise. A certified diabetes educator is a professional that assists diabetics. They help to diagnose prediabetes and work to help those already diagnosed. They teach self-management skills to diabetics, such as glucose testing, medication dosage, and how to properly use insulin pumps. They offer changing your routine in terms of food, fitness, and overall lifestyle to make living with diabetes easier.
Life with type 1 diabetes is similar to life with type 2, by both having to inject insulin, prick finger to check blood sugar levels, exercise, and be on a healthy diet. Once someone is diagnosed with type 1 diabetes, they are immediately placed on insulin and will have to inject insulin for the rest of their lives with every meal. Usually type 1 diabetes is diagnosed at a young age. Once someone is diagnosed with diabetes, they would have to make changes in their lifestyle, such as possibly exercising and changing what they eat if they have been eating isn't very good for them. Checking blood sugar for a diabetic is very important because if their blood sugar is too high, then they have to inject more insulin. But if their blood sugar is low, they would have to eat something to get the blood sugar level up to where it is supposed to be.